Hello students, in today's video we are going to study pharmacology of aminoglycoside antibiotics. Now as we all know, antibiotics are the drugs that are used to treat bacterial infections. Now aminoglycosides are a class of antibiotics that inhibit bacterial protein synthesis. Now in today's video we are going to discuss mechanism of action, adverse effect, then antibacterial spectrum, uses of aminoglycosides. In addition to this, we will also do a comparative study between different aminoglycosides. Now, unlike other antibiotics that inhibit protein synthesis, like for example chloramphenicol, tetracyclines that are bacteriostatic, very important, aminoglycosides are bactericidal and they kill bacteria. Now, very important, aminoglycosides are mainly effective against aerobic gram-negative bacilli. Now, all aminoglycosides exhibit serious toxicity in terms of ototoxicity and nephrotoxicity, and thus their use is confined to serious gram-negative bacillary infections. Now, aminoglycosides are either natural or they are semi-synthetic antibiotics produced from soil actinomycetes, either streptomyces or micromonospora. For example, streptomycin is obtained from Streptomyces griseus, while gentamicin is produced from Micromonospora purpura. Now, let's see to the classification of aminoglycosides. Now, aminoglycosides are not absorbed when given orally, so they are administered parenterally. So, aminoglycosides are classified as drugs that are given parenterally or systemically administered aminoglycosides and topically used aminoglycosides. Now, systemic aminoglycosides are streptomycin, gentamicin, kanamycin, tobramycin, cyclomycin, amikacin, then netilmycin and paramomycin. While topical aminoglycosides include neomycin, then framycetine. Now these topical aminoglycosides are used for the treatment of gram-negative bacterial infections of skin, ear and eye. Now let's understand mechanism of action of aminoglycosides. Now as discussed, aminoglycosides are bactericidal antibiotics. Their mechanism of action is explained in two steps. Now the first step explains how aminoglycosides are transported inside the gram-negative bacterial cell, and the second step explains that once inside the bacterial cell, how aminoglycosides inhibit the synthesis of protein, inhibit bacterial protein synthesis. So, look at this figure. This figure explains transportation of aminoglycosides into gram-negative bacterial cell. Now, as we all know, gram-negative bacteria are covered by a cell membrane, now which is enveloped by a thin peptidoglycan cell wall, which in turn is surrounded by an outer membrane that is made up of lipopolysaccharides. Now, aminoglycosides pass through the outer membrane by passive diffusion. They pass through the porine channels and they reach the periplasmic space. Now, from the periplasmic space, these aminoglycosides, they pass across the cell membrane by an active transport. Now, very important, this transportation is carrier mediated and it requires oxygen. So, this is how aminoglycosides are transported into the cytoplasm of gram-negative bacterial cells. Now, since this transportation is dependent on oxygen, aminoglycosides cannot pass into anaerobic bacteria and are ineffective against anaerobes. Now, in addition to this, very important to understand that aminoglycosides show synergism with the beta-lactam antibiotics like penicillins, cephalosporins, and also with vancomycin. Now, these antibiotics inhibit the formation of bacterial cell wall. So, these antibiotics like beta-lactam antibiotics inhibit bacterial cell wall formation, and this facilitates and this enhance the entry of aminoglycosides into the bacterial cell. So, this is how these aminoglycosides, they reach the cytoplasm of gram-negative bacterial cells. Now, once inside the bacterial cell, aminoglycosides bind to ribosomes. So, look at this figure. This is a bacterial ribosome. It is made up of two subunits, 50S subunit and 30S subunit. Now, this is messenger RNA, and these are codons on the surface of messenger RNA. Now, each codon is made up of 3 nucleotides, and this codon codes for a specific amino acid. Now, this is transfer RNA, and this is the nascent peptide chain that is attached to the transfer RNA. Now, this nascent peptide chain, it elongates by the addition of more and more amino acids, and finally the required bacterial protein is synthesized. Now, for the synthesis of bacterial protein, formation of initiation complex is very essential. Now, initiation complex is a complex between 50S ribosomal subunit, 30S ribosomal subunit, messenger RNA and transfer RNA. So, this alignment is essential. Now, as per the codons on the messenger RNA, new amino acid is transported to the ribosome, and this new amino acid is added to the nascent peptide chain so that the nascent peptide chain elongates, and finally the required bacterial protein is synthesized. Now, aminoglycosides, they bind to several sites. Like for example, they can bind to 30S, they can bind to 50S ribosomal subunit, and they can also bind to 30S 50S interface, that is the surface common to 30S and 50S. Now, here in the diagram is shown the gentamicin. Now, after binding to the ribosome, aminoglycosides interfere with the formation of this initiation complex. So, this prevents formation of bacterial protein synthesis. Now, they also cause misreading of codons on messenger RNA. So, this results in transportation and thus incorporation of wrong amino acid. So, wrong amino acid is incorporated in the nascent peptide chain. So, this results in the formation of non-functional protein, or it causes premature termination of protein synthesis. So, this is how aminoglycosides inhibit the bacterial protein synthesis. Now, moreover, aminoglycosides also prevent polysome or polyribosome formation. Now, normally what happens is this, that a number of ribosomes are held on messenger RNA, so that multiple bacterial proteins are synthesized simultaneously. But as polysome or polyribosomes are not formed because of the aminoglycoside, a single protein is synthesized, and that too non-functional. Now, some of these non-functional proteins, they get incorporated into the bacterial cell membrane. So, the cell membrane becomes too permeable, it becomes leaky, and therefore ions, amino acids, proteins leak out from the cytoplasm of the bacterial cell. So, there is leakage of proteins, ions, amino acids, and thus the cell is killed. And this is how aminoglycosides, they exhibit bactericidal action and they kill the bacteria. So this is the mechanism of action of aminoglycosides. Now very important, aminoglycosides show a narrow therapeutic index. So difference in the blood concentration of aminoglycoside that produces therapeutic effect to the concentration that produces toxic effect is very small. So doses need to be calculated carefully, otherwise it will result in toxicity. So let's discuss few important dosage considerations to be kept in mind while using aminoglycosides. Now, bactericidal action of aminoglycosides is concentration dependent. That means higher is the plasma concentration of aminoglycoside, higher is the rate of bacterial cell killing. In addition to this, aminoglycosides exert a long and concentration dependent post-antibiotic effect. So, as we know that the half-life or T-half of a drug is a very important parameter that determines duration of action of the drug. Now, T-half of aminoglycoside is 2 to 4 hours. So, they should have a short duration of action. But duration of action of aminoglycosides is much longer. Now, this is because of the post-antibiotic effect. And therefore, if the total daily dose of aminoglycosides is administered by one single injection, then this one single injection may be found to be more effective and less toxic than when the same total daily dose is administered by the conventional division into multiple 2 to 3 low doses. So, doses of aminoglycosides should be decided very carefully. Now, let's study adverse effects of aminoglycosides. Now, aminoglycosides produce toxic effects. Aminoglycosides produce ototoxicity. Now, inner ear is made up of cochlea and vestibule. Now, ototoxicity affects inner ear. It damages the auditory nerve. Auditory nerve is the 8th cranial nerve, also known as vestibulocochlear nerve. Now, toxicity or damage to this nerve leads to cochlear or vestibular dysfunction. Now, cochlea is required for hearing and cochlear damage is manifested by the occurrence of tinnitus, that is ringing in the ears, followed by progressive and irreversible hearing loss. So, this causes irreversible hearing loss. Now, vestibule maintains balance of the body. So, vestibular damage produces disturbance in the balance of the body, and symptoms include headache, nausea, vomiting, then dizziness, then nystagmus, that is rapid involuntary movement of eyes, then vertigo and ataxia. Now, ataxia leads to poor muscle coordination which causes clumsy movements. Now, another serious adverse effect of aminoglycosides is the nephrotoxicity. Now, unlike ototoxicity, which is irreversible, nephrotoxicity is reversible if the drug is promptly discontinued. Now, nephrotoxicity causes reversible tubular damage of the nephrons, and this results in the loss of urinary concentrating power of the kidneys, and in addition to this, it causes low glomerular filtration rate. It results in nitrogen retention. It causes the presence of albumin or presence of protein in the urine, which is termed as albuminuria, and it also results in the presence of casts in the urine. So, these casts are the tiny tube-like structures in the urine that signifies the presence of kidney disease. So, the aminoglycosides, they cause nephrotoxicity, but this is reversible provided the drug is stopped promptly. Now, aminoglycosides can also cause neuromuscular blockage. Now, because of neuromuscular blockage reduces the release of acetylcholine from the motor nerve and endings, and reduction in the release of acetylcholine causes muscle relaxation. However, this neuromuscular blockage is usually not produced by the clinical doses. Then contact dermatitis. Contact dermatitis can occur with topical neomycin when the topical neomycin is applied on the skin. So, these are the main adverse effects or toxicities of aminoglycosides. Now, after discussing adverse effects, let's summarize contraindications of aminoglycosides. Now, aminoglycosides should not be used during pregnancy as they induce risk of fetal ototoxicity. Now, caution should be exercised while prescribing aminoglycosides with nephrotoxic drugs like NSAIDs, amphotericin B, etc. Now, avoid use of aminoglycosides with drugs causing ototoxicity like, for example, vancomycin, furosemide, etc. Then caution should be exercised while prescribing to patients more than 60 years of age. Now, as aminoglycosides are nephrotoxic, avoid their use in patients with kidney damage. Now, as aminoglycosides can cause neuromuscular blockage and muscle relaxation, their use should be avoided with muscle relaxants. Now, avoid mixing aminoglycosides with any drug in the same syringe or infusion bottle. So, these are the main contraindications of aminoglycosides. Now, let's discuss some important pharmacokinetic features of aminoglycosides. Now, aminoglycosides are not absorbed orally. Therefore, they are administered parenterally. But a few aminoglycosides, like for example, neomycin is highly toxic. Neomycin is highly toxic to the internal ear and kidneys. So, neomycin is not administered parenterally. Neomycin is rather used topically. So, these drugs are not administered orally as they are not absorbed. Now, these drugs are distributed only extracellularly, and they do not cross blood-brain barrier but crosses the placenta, and therefore they should not be used during pregnancy. Now, aminoglycosides are not metabolized and they are excreted unchanged in the urine. Now, half-life of aminoglycosides is 2 to 4 hours, but longer duration of action is seen because of the post-antibiotic effect. This we have already discussed. Now, aminoglycosides exhibit narrow therapeutic index, so doses should be carefully calculated. So, these are certain important pharmacokinetic features of aminoglycosides. Now, all aminoglycosides exhibit similar pharmacology. Now, gentamicin is the prototype drug. So, let's discuss pharmacology of gentamicin. Now, gentamicin is the most commonly used aminoglycoside, and it is administered parenterally. It is given by intramuscular injection or infused IV. So, it is systemically administered aminoglycoside. Now, antibacterial spectrum of gentamicin. Now, very important to remember that gentamicin and other aminoglycosides are mainly active against aerobic gram-negative bacilli. Now, gentamicin is also active against aerobic gram-negative bacilli, including E. coli, Klebsiella, pneumonia, Enterobacter, Haemophilus influenza, then Proteus, Serratia, and Pseudomonas aeruginosa. Now, many strains of Brucella, then Campylobacter, Citrobacter, then Fancicella, and Yersinia are also sensitive. Now, limited number of gram-positive bacteria are susceptible to gentamicin and to other aminoglycosides like Streptococcus faecalis and some Listeria. Now, gentamicin is ineffective against Mycobacterium tuberculosis. Now, gentamicin is more potent than streptomycin, kanamycin and amikacin. However, it is equally potent to tobramycin, then cyclomycin and nettlemycin. So, this is the antibacterial spectrum of gentamicin. Now, look at this chart. Now, this chart gives a comparative study of aminoglycoside antibiotics. So, first is the streptomycin. Streptomycin is the oldest aminoglycoside. Let's see to the indications or uses of streptomycin. Now, streptomycin is used as one of the drugs in combination therapy that is used for the treatment of tuberculosis. Streptomycin is also a drug of choice for the treatment of rare disease, that is tularemia. Now, in comparison to gentamicin, streptomycin is less potent and streptomycin has a narrow antibacterial spectrum, and thus streptomycin has been replaced by gentamicin. Then gentamicin, as discussed, gentamicin is the prototype drug of this class of antibiotics. It is the most commonly used aminoglycoside. Let's see to the indications of gentamicin. Gentamicin is used in the treatment of serious gram-negative bacillary infections like burns, urinary tract infections, respiratory infections, pneumonia, then lung abscesses, septicemia, etc. all caused because of gram-negative bacilli infections. It is also used in the treatment of meningitis due to gram-negative bacteria. Now, for both these indications, gentamicin is often combined with beta-lactam antibiotics like cephalosporins, as beta-lactam antibiotics inhibit cell wall formation of the bacteria and facilitate entry of aminoglycosides in the bacterial cells. Gentamicin is also effective in the treatment of subacute bacterial endocarditis. Generally, it is used in combination with penicillins, ampicillin or vancomycin because of the synergistic effect. And as already discussed, gentamicin is the first choice aminoglycoside that is commonly used. Now, the next aminoglycoside is the tobramycin. Now, tobramycin in comparison to gentamicin shows superior activity against gram-negative bacilli, namely Pseudomonas aeruginosa and Proteus, and therefore it is used for serious infections caused by Pseudomonas and Proteus. Now, potency of tobramycin is equivalent to that of gentamicin, and tobramycin can be used as an alternative to gentamicin. Now, the next aminoglycoside is the amikacin. Now, one of the main advantages of amikacin is this, that it is resistant to the enzymes that are produced by the bacteria that inactivate aminoglycosides, and therefore it is used as a reserve drug for the treatment of hospital acquired gram-negative infections where gentamicin or tobramycin resistance is high. So, it is used in those infections which are resistant because it is active against resistant gram-negative strains. It is also used in the treatment of multi-drug resistant tuberculosis. So, amikacin is used for resistant gram-negative infections where gentamicin or tobramycin cannot be used. Now, the next aminoglycoside is the neomycin. Now, neomycin is not administered parenterally. Now, neomycin is highly toxic. It is highly toxic to internal ear and also to the kidneys, and therefore it is not administered parenterally. It is given orally, and it is used topically on skin, eyes and ear. So, indications of neomycin. Neomycin is used topically for infected wounds, burns, external ear infections, then conjunctivitis, and other infections because of gram-negative bacteria. Now, absorption of neomycin is minimal when it is given orally. So, administration of neomycin orally before the bowel surgery may reduce post-operative infections. So, here it is given orally. Now, in addition to this, as we know that the normal microbial flora of the colon, that is the normal bacteria of the colon, that produce ammonia. Now, this ammonia is converted to urea by the lungs and excreted. But in the liver disease, in the hepatic disease, like for example hepatic coma, ammonia is not converted to urea. Instead, it reaches the brain and it causes encephalopathy, and the condition is called as hepatic encephalopathy. Now, oral neomycin is very useful in hepatic encephalopathy because what the neomycin does is this, that it suppresses the microbial flora of the colon, and that reduces production of ammonia. So, neomycin improves hepatic encephalopathy. So, neomycin is used topically and it can also be used orally. Now, the next aminoglycoside is the pharmacetine. Now, pharmacetine is similar to neomycin. It is also used topically for skin, eye and ear infections. So, pharmacetine is used topically. Then next aminoglycoside is the paramomycin. Now, paramomycin is the only aminoglycoside that shows activity against protozoan parasites like Entamoeba histolytica, then Giardia lamblia, Trichomonas vaginalis, etc. Then indications of paramomycin. As an alternative to neomycin, it can be used in hepatic encephalopathy. Now, parenterally, paramomycin is used for the treatment of visceral leishmaniasis. So, very important feature of paramomycin, that paramomycin is the only aminoglycoside that is active against protozoan parasites. So, this is in brief on pharmacology of aminoglycoside antibiotics. Now, please note, information provided in this video is meant only for academic informative purpose. For use of aminoglycosides or for the treatment of infections, consult your physician. Now, aminoglycosides are highly toxic. Now, antibiotics should never be consumed without consulting physician. So, if you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.